sorry about the delay, Doc, but I know you wanted to come on just a kind of a bunch of issues, and I guess we'll go ahead and start here because we had been talking here on the show about the hospitalizations rising, yet we're seeing the CAR score go down. Could you start maybe there with the surge in positive cases? We're going on week 3 of a high number of positives, and the hospitalizations have also continued to rise. So what's our status right now, in your opinion, Doc?
So basically with our, so we haven't necessarily been seeing a decline in our CAR score. It's more of a plateau. And so we're about day 13 since our CAR score was 5 and over. And then we've been hovering around 9, upper 8s, lower 9s or so for the past several days. So the way, if you look at this comparably to last year, when in August, and you look at the amount of days after the CAR score was greater than 5, there was quite a different change there. The CAR score on day 13 was 26.2. There were 43 patients in the hospital compared to 17 that are in the hospital this morning. And at that point, we were already seeing 5 deaths during that period last year, whereas right now, unfortunately, we do have 1 recently. And so there is a stark difference. But last year, I would more compare to that initial wave in August as kind of a super typhoon moving through. And actually, the CAR score back then started to decrease after the lockdown and the mitigation and the quarantines that all took place. Here, we're kind of having we just had a recent tropical depression watch, and this is more like a tropical storm that's hovering over us. And as we know, that a very slow-moving tropical storm that just sits on an island can be just as destructive as a really bad super typhoon that moves through quickly. So that being said, we're still steadily seeing increase in hospitalizations. Now we're above 10 every day this past week or so, and our 7-day average is 14.1 people that are currently admitted in considering all 3 hospitals on island. So that's kind of the situation where we're at. So definitely nowhere as bad as it was last time. But this is still not something that we necessarily find acceptable, and we can definitely do better.
Yeah, Doc, and that's what I kind of want to ask, because I think for a lot of people, what's leading to this anxiety, and it's obviously a high level of concern, is you're right. We saw these same numbers at this time last year, and I know that you guys are kind of holding up the vaccination as the reason why this is, and I know you're saying it's not acceptable, Doc, but we're going on week 3, and we haven't really seen strong messaging coming out of Adelup. And I mean, you requested to come on this morning, so I think the community concern is way hotter than the concern we're seeing from elected leaders. And so how do you kind of translate that to people where you don't want to say, oh, it's okay because we reach herd immunity, so, as you were, but then, you know what I mean? You wanted them to take it serious, but I feel like people are thinking you guys aren't really taking it serious.
Oh, by far we're taking it extremely seriously, but we have to also really be able to understand what is the more effective mitigation strategies, and they're very different this year compared to last year, because last year 0 people were vaccinated compared to this year where we have almost 63% of the entire population fully vaccinated. Of those 60 and over, we have like 88.2% of them fully vaccinated. So that's a very big difference. So if we were to shut down, and go into lockdown again, that's not going to be as the gains that we get from that won't be as measurable as we had last year, where that was really the big thing that we could do. So it still remains that vaccinations is absolutely our number 1 way to stop the spread and to keep this wave from developing even higher. And the number 2 is mask wearing, of course. And then number 3 is ventilation. I know we keep talking about the other ones, wash your hands and your distance, but really the top 3 again are vaccination, mask wearing, and ventilation. So that means that if there's any group activities that they're either outdoors or in an area or if it's indoors, a window's open or there's a good air filtration system there. So these again are principles that we really rely on. And so, but other than that, it's really ensuring and that those who've had at least one dose of the 2-dose series, that they get their second dose, because that proves to be very much more effective, especially against this Delta variant.
So, Doc, Dr. Nguyen was on earlier, head of the Governor's Physicians Advisory Group, and even in conversations that I've had with him, in the recommendations that he made to the governor, it wasn't just a Dr. Nguyen recommendation. He was saying, it's a Physicians Advisory Group, it's a state surgeon, so that restrictions should be imposed. And then just today, he mentioned that, we're going to see this executive order. It's going to come out maybe in the next few days, maybe the weekend. What can you tell us about this executive order, and do you feel we need restrictions in place?
And so I can't comment specifically on the executive orders because I don't know the specifics of what the governor is going to decide, but she has been weighing multiple opinions, and it's not just from the Physician Advisory Group, but then from other other voices as well, of course. And so, but she has definitely been very in tune and actually following very, very closely the data that's being presented to her and the trends that we're seeing right now. So in terms of restrictions overall, I already mentioned that the whole complete 100% lockdown is not going to be as fruitful as it was last year. So what do we do instead? Do we go back to limiting gatherings? I still think that our biggest risk factor in terms of public spread is what happens when people basically are eating or drinking, because those are situations where your masks are off and you're talking, and in a lot of cases you're talking loud, and that's just a recipe for transmission. So what do we do to mitigate that risk, overall? And so right now, restaurants and bars are allowed to be at 100% capacity, and so there needs to be some heavy consideration on that. We've already seen places like New York and San Francisco putting in measurements where you have to be fully vaccinated in order to be able to go into these restaurants or bars and gyms and other indoor spaces. And so that's something that, of course, is being heavily considered as well. And it's also a matter of how to make that practical and not to put a tremendous burden on the businesses here also in terms of how to enforce that, and that they have proper guidance as well if that were to be the case. And so that's something to consider. And those that choose not to do it, what are their options also? What I mean by that is a business chooses not to require vaccinations. What are their restrictions instead? And so those are all things that are being there, and I suspect that that we'll get some more clarity before the week's over.
Okay.
So are these the type of restrictions that where, like you said, restaurants check the vax status? If they allow vaccinated people to eat indoors, they can operate 100% capacity, but then everyone who's not vaccinated has to eat outside and wash the vaccinated people's dishes afterwards? Yeah. Well, as long as they keep their mask on, right? But no. But again, there's a variety. I won't go into all the different scenarios that are being presented, but I'll just leave it as that. That there could be a variety, and it may be a difference in capacity within the establishment also if you're not requiring vaccinations. So that's one consideration as well. Doc, what about the VA? Is it VA PPC or VAAPC? VA PPC.
Yeah.
The vaccine council.
Antiviral something.
Yeah. So I know that the FDA came out with the guidance for the third shot for, is it the elderly and immunocompromised? So where are we with? Yeah, so specifically the immunocompromised. Right. Yes. Yeah. And so so what's very specific, and I want to be very clear that these are not booster shots. They're considered additional doses. A booster shot is if you actually completed the series and you've achieved a level of immunity, but then that immunity may be waning, and then you need a booster shot to get you back up to that part. People with moderate to severe immunocompromised states, when they were vaccinated, never, in all likelihood, never achieved that full immunity point. And so really what they need is that additional dose to get to that point. And the studies have shown that with the mRNA vaccines, more specifically Pfizer and Moderna, that it's very effective in getting this third dose 28 days after you've completed your second dose. And so what we've seen is that it definitely provides a much more protection for them because they themselves are already high risk of complications of COVID. So that's the key part there. So the FDA and this, expanded their emergency use authorization to allow for these additional doses. But we have to be very clear that it doesn't mean that anybody can go ahead and get this. That it has to be within the EUA's restrictions, and so we have to be very clear that that's what it's for. So it's not just because we think somebody's at high risk of having complications that they get this additional dose. It really has to be, is it a high likelihood that you did not achieve full immunity after getting your 2-dose series? And so just so we're clear, we're talking about, so the FDA phrased it as those who have, for example, solid organ transplants, like a kidney transplant or a heart transplant, and they take immunosuppressives to not reject the organs. They say that level of immunosuppression or equivalent. Thankfully, the CDC came out with even more specific guidelines for that. And so we're talking about, patients also who have autoimmune disorders that are on immunosuppressive therapy, persons who, for example, may be end-stage renal disease on dialysis, people who don't have spleens, patients who have cancer who are actively being treated for cancer or have or recently completed cancer treatment. So if you had cancer, 20 years ago and you're in remission, and you got your vaccine this year, then that doesn't necessarily mean that you were immunocompromised and you need this additional dose. And then the other examples are like persons with HIV who are uncontrolled, for example, and so they have an immunodeficiency as well. So it's these specific patients, and the key part here is that yes, the BAPPC recommends that that persons who get this do it at the recommendation of their provider, their doctor or nurse practitioner or PA. But also there is still the opportunity that if a person does feel that they meet this criteria, they can present to any public vaccine clinic, Micronesium or what have you, and self-attest that I meet this criteria. And then it will be reviewed by a healthcare provider there. And the goal is to ensure that these people who need it definitely get their additional shot.
Wow, so it sounds like it's a pretty strict eligibility. So don't just show up at the vax with Tanchai and like, oh yeah, she's old, give her the shot. Then Doc, because a lot of the Monumco were vaccinated early on, and you're saying that the FDA is recommending it 28 days after the second shot. So how do we address that timeline for those who are...
So nothing earlier than 28 days.
I see.
Is the point there. But also what's very, very important to note is, of course, what has been announced out of the White House that by next month, more specifically around September 20th, so almost exactly a month from now, is the actual allowance of booster shots. So these are not, so really for this month-long period, we're really focusing on these immunosuppressed patients, but but in terms of for other people who are at high risk, getting a third booster shot, that may very well be have its green light a month from now. And so there's early peaks of the data, and these again are from Pfizer, Moderna, that show the effectiveness of getting a booster shot 8 months after you completed the series. So that's a clear part. And then once we get that more clear guidance, of course, the local BAPPC will help based on our supply, which I don't think the supply is going to be an issue, who are prioritized in that process. And we may not have to prioritize anybody. We may have enough and enough capacity that we can just start rolling that out because, again, 8 months is a while. And so there's still a lot of people that don't even need that 8-month period.
Right.
But of course, our Monumco are going to be one of our highest priorities. Of course, the healthcare workers are our high priority as well.
Do you see that's how that's going to be rolled out? Just kind of how it was done back in January, where you had those priority groups. That's kind of the same.
If you remember, as the initial part of the rollout, the big reason that the priority groups were so important was because of the supply, the vaccine supply. And so we don't necessarily foresee that. And also because we're dealing with one shot and with both Pfizer and Moderna. Remember when we first started out, we only had Pfizer. And then, there's also the question about the Johnson & Janssen vaccine. The data on that is still, it will be coming out in the next few weeks. And then who knows, there may be, announcement that includes all 3 vaccines by mid-September or so.
So we are looking to follow this September 20th time
that's what
that
they're
was given
announcing
by
right
Biden,
now.
the Biden administration.
Sure. And so that's what what the Surgeon General, Dr. Vivek Murthy, his statement was pretty much saying that, look, if we're going to start moving into the phase of booster shots, we can't just flip the switch that this preemptive announcement a month prior is important so that questions can be answered and people can start being, and areas can start being prepared to administer these additional booster shots.
Doc, and when you reached out to me, you said you also wanted to discuss available treatments to keep recent positives from needing hospitalizations or worse.
Yeah. And so, there are these monoclonal antibodies that can be given to those who don't need hospitalization but have mild to moderate symptoms and are at high risk of having complications of COVID. And so, for example, when President Trump had COVID, was very popularized because he got the Regeneron cocktail, so to speak, of monoclonal antibodies, and that was a treatment to help prevent him from progressing into a more severe disease. And so that medication is it's an IV infusion, so it's not just a pill that you can pop. We've been able to give similar medicines since late last year, and that was the bamlanivimab. That very long, hard word to say. That's the infusion. So we've had that capability. Yeah. So we've had that capability, and so right now, the main medicine that's being used is the Regeneron cocktail, and so that's what's so GMH has their supply. Right now, they're primarily giving it to those who are seen in the emergency department who are sick with COVID, but then are not needing to be admitted to the hospital, and they're discharging home from the emergency department, and then they will give them that treatment at that time. GRMC had been able to do this as well, and so we want to ensure that that the capacity is there, and then that this referral process is still in place. And the criteria for those high risks is actually really broadened. So initially it was those who are 65 and older. If you have diabetes, you have chronic kidney disease, active cancer. If you're 55 and older and you had heart disease, so it was all this specific list. And then one of the key things, there was obesity with specifically a body mass index of 35 and over. Just so for reference, a normal body mass index or BMI is 20 to 25. 25 to 30 is considered overweight. 30 and over is considered obese. But they had initially said 35 and older. This new recommendation, it brings it all the way down to 25. A body mass index of 25 and over, which is technically overweight. And just for reference, my BMI is 25.0. And so, so if you want to, look at that to reference, so a large portion of the population here on Guam is unfortunately meets that criteria. And so it will be broad, but of course we would like to prioritize these treatments because they are not so easy to administer. I mean, it's not like just simple. You can, it takes a couple of hours to give. Some of the processing part and the infusion part being about an hour. That we do want to prioritize those who are higher risk.
Doc, are those treatments effective against the variants?
So far, that's what it's proving to be. The bamlanivimab, one that it also included an additional monoclonal antibody, that has actually been put on hold for now because of they did see that it wasn't as effective as Regeneron. So that's why Regeneron is the one that's actually being focused on right now. The other name for it, the brand name is RegenCove. So that's if you may hear it called that as well.
Doc, I just wanted to get your opinion real quick. With a lot of these breakthrough cases, and obviously us being on a 3-week surge here, what Dr. Ho has called a Delta surge, Are we considering at all discussing reinstatement of quarantine procedures?
Yeah, so I want to make sure that we understand some certain facts, and that when we hear breakthrough case, somebody who's been fully vaccinated, that gets a lot of attention, right? Whereas the ones who are unvaccinated don't get necessarily the same amount of attention. But we got to look at it the perspective there. So basically, what our numbers here on Guam show is that if you are vaccinated, if you are unvaccinated, you are 3 times more likely to catch COVID than somebody who's unvaccinated. What's even more striking is that with our hospital data, and this is hospitals across the 3 hospitals, is that if you are unvaccinated, you are 33 times more likely to be hospitalized than somebody who is unvaccinated. Versus somebody who is fully vaccinated. Fully vaccinated, yeah. So you're unvaccinated, you're 33 times more likely to be hospitalized than somebody who is fully vaccinated. So in other words, vaccines are extremely effective. They are not 100%. We've never said they were 100%, but you want to give yourself a good, good odds. I take 33 times, the odds in that situation. And so if you are somebody, there's still just under 3,000 Manamku 60 years and older who are not fully vaccinated on this island. 3,000, so that's still a tremendous amount that are still at risk. And so, we still have to push and encourage more vaccinations. And please, that's where we need everybody's help. And that if you have family or friends, that you help them understand and try and listen to them also why they may not be open to getting the vaccine. And it's important to also be able to say that this is one of the most studied, most scrutinized vaccines in history, and that a lot of these worries are not something that really hold water. It's just not true. Right now, there's over 4 billion doses that have been given worldwide, across over 180 countries. I mean, that's tremendous. This is the biggest vaccine rollout in history. And so we have so much data on the safety of it. And I think it's really important to recognize that.
We did have a question from one of our online viewers. Who are the real spreaders, vaccinated or not vaccinated?
Not vaccinated. So let's be clear. In order to, first of all, in order to be a spreader, you need to be infected. And like I mentioned earlier, you're at least 3 times more likely to be infected if you're unvaccinated. And that's just in general, right? And that's asymptomatic, symptomatic, just overall. And so right away, you're more likely to be a spreader if you're unvaccinated, and because you're more likely to get it. So yes, some people do have the breakthrough cases if they're fully vaccinated, and it shows that they can be infectious as well. So that's why still everybody still has to mask up, even though you're fully vaccinated. And that's where there's an important part there.
Have you seen, is there any new clusters to report?
So there's ongoing investigations. There's some that are still trying to be connected, where we think that there are some new ones, but nothing definitive at this point.
Okay. Dr. Ho, he was mentioning the need and is requesting public health to open up more community testing centers. We've seen the lines over there at the old carnival grounds in Tidsen. Are you guys taking that into consideration?
Yeah, I want to also recognize, how much testing has been done, especially over the past 3 weeks or so. Prior to, around Liberation Day, that the weeks around that, we were averaging around just over 300 or so tests per day. Right now, we're pushing 900 tests per day on average, and that's both the civilian and Department of Defense side. And so that's a tremendous amount of testing already being done. And yes, the demand is still high, and we definitely do need to do more, and we're looking at ways to be able to allow more testing capacity. Because really, it's the sampling part that's the big limiting step, because we have so much availability in terms of running the test, which is complete, which is was the main issue, of course, last year, early last year in the pandemic.
Did you have any more?
Good.
No? Okay. Just on hospitalizations, did you say 17 hospitalizations as of this morning?
Yeah, as of 8 a.m. this morning, there's 17 hospitalizations. And of the 17, 4 in the ICU. And so right now there's 8 at GMH admitted, and then 9 at GRMC that are admitted. 2 of them each have, each of them have 2 ICU patients, but none of them are on a ventilator.
Mm-hmm. Any fatalities?
I'm sorry?
Any fatalities?
No new fatalities to report.
Doc, we had a question here in the comments. If non-vaccinated people are more likely to be spreaders, oh wait, hold on. Why aren't people who got the shots encouraged to get tested too, since both shots and those without shots can spread? Why only single out those who haven't gotten vaccinated?
I don't know who's singling out anybody who's unvaccinated to be the sole people to get tested. We encourage everybody to be tested if you've been contact. In fact,
Doc, I think they're referencing the vaccine mandate, where if you don't have the vaccine, then you have to get like a weekly test, or else you're gonna get fired.
Yeah. And so the weekly test is because look, the way you have to look at it is if you're vaccinated, then you're in one category. If you're unvaccinated, you're in a completely different category, and we have no way to mitigate that or to understand, to balance out that risk. And the one way we do know that's been proven, especially before vaccines were available, was weekly testing. And you look at colleges throughout the country that did weekly testing with their students last year, and these are just the antigen tests specifically. Okay, these are the easier ones that you know right away. That their rate of infection was nearly 0 in terms of spread compared to others that didn't do that, where it's more like 15% of the student body ended up being positive over like a month period or so. And so it's a big difference and shown to be effective. And so that's why it is important. And so depending on how on what the data looks like, the testing, routine testing for those who are vaccinated. Right now, we're not having the data that supports having to do that. But for the unvaccinated, for those who either refuse to be vaccinated or are unable to be vaccinated, that is something that we have to have a different way of mitigating to keep the workplace safe.
Okay, Doc. Thank you. Good to have you on again.
Any final message to the community about what's happening right now?
Well, what I say is, again, it's one of the things that's so important is that we understand what and how the virus spreads, and that when you think about somebody smoking in a room, that you're going to smell that smoke pretty heavily if the room's not ventilated. And it's the same thing with the virus. And if you're not wearing a mask, and if you're talking and you're sharing a meal, that is a very high place to spread, and that's still the case in workplaces in particular, where people take breaks together and then they are in a small break room and they take off their masks and they eat and talk. And so that's a very, that's a big place of transmission at this point. And so that's something that we have to be very cognizant of. And the last thing I'll just say is that, again, for those who are unable to be vaccinated, and particularly those who are 12 years younger than 12 years old, the best way to protect them is to have everyone else around them being vaccinated, especially who they share the most time with, which is those that they share a household with. So those in the same household, if you're 12 years and older, then we really recommend that you get a vaccine to protect them.
Okay, Doc. Thank you.
Thanks, Doc.
All right. Thank you, everyone. Have a good day.
You too. There you go, Dr. Felix Cabrera, the Chief Medical Officer for the Department of Public Health and Social Services. A lot of info there.
Yeah.
Processing right now. We got to take a break, guys. It's 9:52. This is The Link. We're proudly brought to you by Pacific Points, Cabo Enterprises.